Hi, Mike Gibson Ray coming to you from ESC 2023, and we're talking about the Clear Outcomes Study, in particular the diabetes subgroup. Kosh, remind us about what Clear Outcomes was, and then tell us what you found with the diabetes subgroup.
Thanks, Mike. So Clear Outcomes tested a novel oral lipid-lowering therapy called bempedoic acid against placebo in people unwilling or unable to take statins. It included secondary and primary prevention patients and recruited just over 13,500 people over 3.4 years, event-driven. Now, what that trial showed is that for a 4-point MACE outcome, relative risk reduction was about 13%, and for 3-point MACE, that was about 15%. Now, we have the opportunity and we pre-specified this analysis, to study the potential benefit in people with diabetes. Now, why is that important? Well, ezetimibe and PCSK9 lowering therapies have all been tested as an add-on to statins, and these were all people with established cardiovascular disease. So about 40% of our cohort had diabetes, of whom half are primary and secondary prevention patients. So for our physicians, if you can't take a statin, you've got diabetes, you've got high risk, well, what do I do? Because all of the others were combination therapies. So we answer that question. The second important question that has arisen over the last 10 years is because statins are known to increase new onset diabetes in those who are normoglycemic or pre-diabetic, every lipid lowering therapy now looks out for this. Can we say that this approach is safe? So we answered two questions. And what we found is that compared to the overall study findings for essentially for the 4-point MACE and also for the 3-point MACE. So for the 3-point MACE, for example, which is probably even more important, we had a 20% relative risk reduction. But what's really important for cost, health economics, and numbers need to treat is the absolute benefit. Because people with diabetes have so much of an increased risk. The absolute benefits for the 4-point MACE is 2.4%, the 3-point MACE 2.1%. So it's about double what you see with the normoglycemia pre-diabetes groups.
So at about 2.4, you'd only need to treat 40-some patients to...
Exactly.
Good.
So,
Wow.
I mean, that's really good. And remember, these are people who couldn't take statins. And so what's your first line therapy? I mean, it suggests that this drug, as an oral agent taken daily, reduces LDL by 25%, has a big treatment benefit because risk is so high. So that was good. And then when we looked at roughly about 8,000 or so individuals who were classified as pre-diabetes or normoglycemia, both overall and within each strata, no signal for harm for worsening HbA1c or glucose or new onset diabetes. Interestingly, what we noted was a very statistically significant but very modest weight loss. He was talking about 0.4 kilograms overall. And you might say, well, you know, is this real? Is this not real? Well, I'll give you some context. We know in the statin trials, when we looked at the meta-analyses of those, there's a modest weight gain. It's about the same, but in the opposite direction. It's about 0.3, 0.4 kilograms. And previously, when we looked at Mendelian randomization, and we looked at the target for bempedoic acid, that's exactly what you'd have seen. You'll have seen a neutral effect on diabetes. You see a slightly lower waist-hip ratio. And for the statins, the target HMG co-reductase, it's in the opposite direction. And we know that both drugs, although they will reduce cardiovascular disease events, there's a clear difference between them, both based on lifetime genetic exposure and shorter exposure with drugs. And it goes in the same direction, which provides us with some assurance, longer term, for example, that actually what we saw in these short-term trials should basically also be valid longer term.
You know, my son always makes fun of me. He always says, Dad, why are you doing these big trials? Nature has already done the randomized trial. And he just walks me over to the computer, gets me onto the UK Biobank and shows me things like this. So it's always great when the trial data matches the Mendelian randomization data. So in this instance, a little bit of weight loss and no increase in diabetes. A 2%, 2.4% absolute risk reduction puts you at about 40 people to prevent an event. That's all very reassuring and compelling data. Well, thanks for sharing with us today. Thanks for joining us, and thanks to all of you in the audience for joining us here from ESC 2023.